Right now on ABC 10 News at 4 o'clock, active duty troops in the U.S. military ordered to get the COVID vaccine immediately. The effort to implement the mandate here in San Diego. And we continue to learn more about what led a pilot to land his small plane on the 5 near Del Mar, where the investigation into the emergency landing stands today. And the Biden administration is ordered to reinstate former President Trump's Remain in Mexico policy, the effect on migrants packing shelters in Tijuana.
ABC 10 News at 4 starts now.
Tonight, local immigrants' rights activists are speaking out after the Supreme Court refused to block a court ruling ordering the president to reinstate the Remain in Mexico policy. Good afternoon. I'm Kimberly Hunt. ABC 10 News reporter Jennifer Kastner explains shelters in Tijuana continue to overflow with migrants.
As encampments south of the border swell with migrants seeking asylum, activists are sounding off about the reinstatement of the controversial Trump-era Remain in Mexico policy.
In Tijuana alone, the shelters are packed with migrants.
Pedro Rios with the American Friends Service Committee spoke to ABC 10 News Wednesday following Tuesday's ruling by the U.S. Supreme Court.
This decision makes a really terrible situation even worse because it ensures that migrants who would be allowed to present themselves for asylum reasons are going to have to wait in Mexico again, many of whom don't have a fixed address, and then are become easy prey for people who want to extort them or take advantage of them.
The policy, also known as the Migrant Protection Protocols Program, or MPP, had been halted just after President Biden took office, but Missouri and Texas filed suit, arguing concerns over safety and security. Texas Attorney General Ken Paxton praised this week's ruling in a tweet, writing, "Paxton wins again." Wednesday, Jewish Family Service of San Diego criticized the ruling, writing in part, "JFS worked tirelessly yesterday, the last day of processing and crossing, to assist as many individuals and families through the MPP wind-down process as possible. Working through the night, we welcomed an additional 37 individuals, comprising 16 families."
The United States must adhere to international protocols for protecting people who are seeking asylum. It needs to ensure that there are enough resources to accept people and process them in a humanitarian way that doesn't degrade or denigrate them in any way, shape, or form.
Jennifer Kastner, ABC 10 News.
All active duty troops in the U.S. military must get the Pfizer COVID vaccine immediately. The Pentagon announced the nation's strongest vaccine mandate after Pfizer's shot got full FDA approval on Monday. ABC 10 News reporter Mimi Alcala is joining us now live outside the Naval Medical Center in Balboa Park with more on how this new mandate will be implemented. Mimi?
Hi, Kimberly. Yeah, our local military leaders say they got this memo really early this morning, and they're working very rapidly to make sure the remaining Marines and sailors do get vaccinated. They're going to be able to give up to 7,000 doses daily at local military hospitals like here at Naval Medical Center in San Diego and also Naval Hospital Camp Pendleton, as well as other shots in the field. The Secretary of Defense ordered the vaccine mandate after the FDA fully approved Pfizer's vaccine earlier this week. He sent a memo directing secretaries of the military departments to immediately begin full vaccinations of service members on active duty or in the ready reserve, including the National Guard. There will be religious and medical exemptions. However, those who don't want to take the vaccine for other reasons will be able to sit down with a physician and their chain of command to talk about the risks their objection could impose on their teammates. Now, I spoke with two military veterans, G.I. Wilson and Gene James, who say they received countless vaccinations throughout their military careers, and mandates for service members isn't anything new or shocking.
I think it's pretty much part of standard operating procedure. I mean, in my 30 plus years in the military, we received countless vaccines, everything from yellow fever to anthrax. And I don't see this as a departure from what the military has done for at least decades.
I'm a believer in vaccines. Colonel Wilson and I both are the product of a generation that was saved as a result of the polio vaccine.
And we're told local military members can get their vaccine anywhere in the community. It doesn't have to be at a DoD provider. They just need to bring proof of that vaccine card so that can be entered into their medical record. Reporting live, Mimi Alcala, ABC 10 News.
Johnson & Johnson says a booster shot of its single-dose vaccine looks promising. The company says a booster generated a big spike in antibodies for people who got a second dose 6 to 8 months after their first. Now, the data comes from 2 phase 2 trials, one in the U.S. and one in Europe. J&J is now in talks with U.S. health agencies about issuing recommendations for its booster shot. States are still having trouble getting rental assistance to those who need it. Only $4.7 billion of the $47 billion in federal funding has been used. The Treasury Department oversees the program, but it's up to more than 450 state, county, municipal governments, and charitable organizations to disperse it. Many have had to create new programs and hire new staff to make this happen, creating delays. Well, the Biden administration is trying to help with that by adjusting existing guidance on how money is distributed. In order to speed up the assistance approval, the Treasury Department is now allowing grant programs to accept written proof of employment and income from tenants and landlords instead of the usual required documentation. The department is also establishing clearer guidelines on how state and local grantees can work with nonprofits to get money to people in need.
As many as 1,500 Americans are still awaiting evacuation from Afghanistan. That's according to the U.S. Secretary of State Antony Blinken. And he says 4,500 Americans have been flown out of the country since August 14th. There have been 82,000 evacuations in all. The Pentagon says it conducted a third helicopter evacuation overnight to bring evacuees to the airport.
Last night, during the period of darkness, there was an operation to be able to go out and safely evacuate evacuees.
President Biden's August 31st deadline to have everyone, including our troops, out is now just 6 days away. The first sentence in the plot to kidnap Michigan's governor this year was handed down today. Ty Garbin will spend up to the next 6 years behind bars. He will also be supervised upon release, get substance abuse treatment, and he can't use a computer without it first being approved. Garbin cooperated with investigators after pleading guilty, and there are 13 other men charged in the plot. They have all pleaded not guilty.
Dr. Anthony Fauci wants hospitals to take advantage of antibody treatments to treat patients with COVID. Now, 3 products are available under emergency use authorization, but Dr. Fauci says they're still being underutilized. Antibody drug infusions can help patients with mild to moderate symptoms. They also work in preventing someone from getting sick with COVID if they've been exposed to someone who is infected. Monoclonal antibodies were already used for the treatment of other illnesses. But when the pandemic started, companies like Regeneron developed them to fight coronavirus.
The biotechnology industry figured out how to use those to basically make targeted missiles toward molecules that were causing problems.
Antibodies essentially target the coronavirus spike protein. The earlier the treatment is administered, the better it works. Doctors emphasize this treatment is not a substitute for the vaccine.
So right now, there's a fair amount of provider discretion into who gets the antibodies. So we start out obviously with the highest risk patients, but there are a lot of people who have medical problems that would want the treatment. And given the fact that it's, our hospitals are overrun and we know it's beneficial, it's pretty much loosened up.
Since last month, demand for antibody treatments has gone up 5-fold. Most of the drug supply is going to states with low vaccination rates. Health and Human Services also says it's reaching out to states to help expand access. Now, there is no cost to patients in most cases for the antibody product itself, but there can be costs to administer it, and those costs vary.